Hello there, welcome to my channel. Today we will be learning about chest X-rays. Chest X-rays are indicated for symptom evaluation, pre-operative checkup, screening for diseases, fitness certificates and follow-up of respiratory and some cardiac diseases. Penetration of X-ray beam is dependent on tissue density. That means that a denser object leads to more absorption of X-ray beam. Hence, less beam strikes the film, making the film look whiter. Similarly, less dense objects lead to a blacker film. A common mnemonic to help remember the radiological densities of various entities is, Ashish felt sorry for cursing medicine. Here air is the most radiolucent entity and metal is the most radio-opaque. We need to consider the following points while evaluating a chest X-ray. Label of the X-ray, that is whether the X-ray is of the same patient or not. The X-ray should be labeled left or right side. We should see for both rotation as well as tilting. The film should neither be under or overexposed. The X-ray should be free from any artifacts. Chest X-ray can either be posterior-anterior view, anterior-posterior view, lateral view or lateral decubitus view. This image shows how chest X-ray PA view is taken. These are the common features that can be seen in a chest X-ray PA view. Kindly note that the left atrium and the right ventricle are not visible in a normal chest X-ray PA view. This image shows the approximate delineation of various thoracic structures seen in chest X-ray PA view. The apparent cardiomegaly in the chest X-ray app view occurs due to the position and the distance of heart from the X-ray film. Hence, cardiomegaly is better assessed in PA view of the chest radiograph. Chest X-ray app view is only preferred if the patient is immobile or hemodynamically unstable. Some differences between PA and app view are as follows. Scapula seen in periphery of thorax in PA view while scapula is over the lung fields in app view. Clavicles project over lung fields in the PA view whereas clavicles are above the apex of lungs in app view. In PA view, posterior ribs are distinct while anterior ribs are prominent in the app view. These images clearly show the differences as enumerated in the previous slide. The left image shows how lateral view of chest X-rays are obtained. The right image shows the structures seen in the lateral view. Chest X-ray lateral decubitus view is a specialized projection that is now rarely used due to the popularity of computed tomography. It is chiefly used in the pediatric population for small pleural effusions, pneumothorax and air trapping due to inhaled foreign bodies. Here, patients should be lying either left lateral or right lateral on a trolley. Detector is placed landscape posterior to the patient running parallel with the long axis of the thorax. Patient's hands should be raised to avoid superimposing on the region of interest. Legs may be flexed for balance. Rotation of shoulders or pelvis should be minimized. X-ray is taken in full inspiration. When investigating pneumothorax, the side of interest should be up. When investigating pleural effusions, the side of interest should be down. As already mentioned, chest X-ray should be screened for labeling, tilt, rotation, exposure. Chest X-ray should be screened from outside to inside so as not to miss any findings. Soft tissue is screened first, followed by the bony cage, mediastinum, diaphragm, pleura and then lung parenchyma. Can you tell which chest X-ray is normal? The left or the right one? Kindly mention in the comments below. Chest X-ray can be used in diagnosis of a variety of conditions as enumerated over here. Thank you for listening to this video. I sincerely hope that you learnt something from this presentation. Stay tuned for the second part.